So I kind of went out of order here. So our next speaker is somebody who has been really working with a lot of health equity within our community and various communities around. And I'm really, really excited to have this individual come up. He is a doctor, and I'm excited to have him come up because of the fact that all the work he's been doing, making sure that we, one thing was making sure that COVID vaccinations were passed out to brown and black people, and that we had the access to them. So I'm really excited for him to be up here speaking. Ladies and gentlemen, Dr. Daniel Muñoz.
How's everyone doing today? Good? All right, rain or shine. So again, my name is Luis Daniel Muñoz. I normally don't write or read from pieces of paper, but today I had a little nerves, so I apologize for that. I'm grateful for this opportunity to share this space with you all. And when I was thinking about, what I would say today, I mean, there's some healthcare stuff that I will say, but what kept coming to mind was really unbreakable, unconditional love. Those were the first words that came to mind when thinking about this moment. How unconditional love is unaltered, even when it's confronted with extraordinary pressures to change. That's the beauty of this moment and of this community. As an organizer, medical doctor, and equity advocate, I've had the privilege to better understand my own journey through the intersection of many people and identities, and some that are on this stage today. And it's amazing how the intersection of our identities, experiences, and struggles, in those intersections, that is, we find connection, we find love, we find the warm embrace of a larger community, a community empowered by this truth, that where there is collective struggle, there is collective purpose. It's hard for me to speak about struggle without also acknowledging how difficult it was for me to understand my own growing up. As a person who grew up in poverty, observed addiction destroy loved ones, while also witnessing the weight of a patriarchal system that left my single mother with little opportunity to improve our circumstances, it's taken me a long time to understand how to affect progress. Whenever I'm given this mic, there's also this pressure to give hope to those that are listening. But it's always been different for me, that pressure and what comes from it. You see, that beacon of light that reflects from a lighthouse is less real to me than the lighthouse keeper. The person who sits in isolation, in the dark of night, in the depths of their own thoughts, doing the work, knowing that at one point in time, the light beside them will align with their sight. And projected across that line, that arc of visibility, as they say, in that moment in time, for once they find connection with another person. And that's what this moment is for me, and that's what every moment on the mic is for me. Looking out into the crowd and finding that connection. My hope is that what connects us today will help us move collectively tomorrow. A community rooted in love and interspersed across classes, races, and places. This community has the power to catalyze and transform inequitable systems, to amplify the call that Black Lives Matter, that trans Black lives matter. It's clear that social conditions create health conditions, and the data is out. Government institutions and healthcare systems are not adequately serving the LGBTQIA plus community. We see lower rates of health insurance coverage. We see higher rates of people experiencing violence by the hands of others. Higher rates of discrimination. And as a result of those social conditions, we see higher rates of mental illness and higher rates of chronic diseases. We're fighting for human rights. We're moving for humanity. If any political leader and elected official in their deeds or in their policy are not moving on those principles, vote them out.